Hello everyone, I am Dana Luis from the SN28, and for today's video, I am going to demonstrate the administering intramuscular injection. So prior to our first step, we are going to welcome the patient with a warm smile and greet them politely, and also explain the rationale behind the procedure that we are going to do. This is to gain trust and reduces their anxiety about the procedure and will give them the knowledge about what we are going to do. Hello ma'am, welcome to our facility. Please be seated and make yourself comfortable. So hi ma'am, I am Dana Luis, a student nurse from Davao Oriental State University. So for today, I am your assigned nurse. So I am going to administer the intramuscular injections. So the intramuscular injections deposit vaccine into the muscle fascia, which has a rich blood supply allowing vaccine to be absorbed faster through muscle fibers. So the IM injection sites can absorb larger volumes of solution, which means a range of medication such as sedatives, anti-emetics, hormonal therapies, analgesics, and immunizations, and can be administered intramuscularly in a community and acute care setting. So there are many types of vaccines that administered intramuscularly. So one of these are the hepatitis B, and it is a recommended type of vaccine that is given 24 hours at birth of the baby along with the BCG vaccine, and is administered intramuscularly at the anterolateral aspect of the left mid-thigh of the baby. So the second is the pentavalent vaccine. It is the type of vaccine that is administered out at the outer right upper thigh of the baby intramuscularly, and 3 doses of this vaccine are needed to be administered during the 6th, 10th, and 14th week age of the baby using the 0.5 ml syringe. The third is the pneumococcal conjugate vaccine or the PCV vaccine, and it is given with 0.5 ml also at 6th, 10th, and 14th week of age of the baby, and is also administered at the outer left upper thigh of the baby. So the contraindication of this vaccine is that the anaphylaxis or the hypersensitivity. So and the last vaccine is the administered using the intramuscular site injection, which is the inactivated polio vaccine or the IPV. This type of vaccine protects the infant from getting infected by the polio virus, and it is administered with full intramuscular site. So ma'am, do you have any questions or clarifications? Okay ma'am, thank you ma'am. The next is to prepare the vaccine as per agency policy. We first ensure that the vaccine is properly identified by its name, the manufacturer, and expiration date. To perform the hand hygiene using the ABHR that contains 70% alcohol solution. Then let the hand dry for 30 seconds. Then we prepare the table. The next is to prepare the intramuscular vaccine and a special syringe to be used, which is the dose is 0.5 ml dosage. Supplies to be used. Then we provide privacy to the patient by draping the curtains and closing the doors. To verify the vaccine administration record using the mother and baby booklet to the client by asking the caregiver or the mother. So ma'am, what is the name of the baby and its birthday?
Camila.
Your name po ma'am?
Angel Herbito.
Angel. So, ma'am, does the baby have the first dose of this vaccine, ma'am? Yes. So, after the previous dose po ba, is there any occurrence of allergic reaction or? Next is to select the appropriate site for administration, then assist the patient in the appropriate position as required in IM injection. So ma'am, can you cuddle the baby and probably thanks. Next thing is to do again the hand hygiene using the alcohol-based hand rub. The gloves. Next is to don the non-sterile gloves. After donning the non-sterile gloves, we must ensure that the sharp disposal container is close to our disposal of the needle after the demonstration. After locating the correct site of the landmarks, we so the hepatitis B is can be administered at the outer mid thigh, while the IPV is administered outer left upper thigh, while the pentavalent vaccine is outer right upper thigh, and the PCV is outer left upper thigh. And we should clean the area with warm water and allow the site to dry completely. Allowing the site to dry prevents stinging during the injection. So after cleaning or cleansing the site, we place a gauze or cotton balls in the third or fourth finger of our hand. After we remove the cap of the injection, we put the syringe between the forefinger and the thumb. With the non-dominant hand, inject the needle quickly into the muscle at a 90-degree angle, using a steady and smooth motion. After the needle pierces the skin, use the thumb and forefinger of the non-dominant hand to hold the syringe. If required by agency policy, aspirate for blood. If no blood appears, inject the vaccine slowly and steadily. Once vaccine is completely injected, remove the needle using a smooth, steady motion. Remove the needle at the same angle at which it was injected. Then the next is to cover the injection site with sterile gauze or cotton balls, using gentle pressure and apply band-aid as required. Then place safety shield on needle and discard syringe in appropriate bin. First put the cap before discarding it. Discard all other supplies used and the gloves that we used. Then we do the hand hygiene for the last time. Then dry it for 30 seconds. Is to document the procedure and findings according to agency policy. The proper documentation helps ensure patient safety. And ma'am, I'm going to document the time, date, location, and type of vaccine injected into your booklet as well. The last step is to evaluate the patient's response to injection within the appropriate time frame. So ma'am, if there are any adverse effects after this vaccine, please do see me and yes. Thank you, ma'am. That's all for today's video, and thank you for watching administering the vaccine using the intramuscular injection.